Medical experts are tonight warning that the country is likely to experience a surge in COVID-19 cases, especially with flu incidents being high during the wet months of March and April. But of concern to the experts is the continued rise in the test positivity rate, with a record of above 5% in the past week. In addition, Kenya is still not testing enough to give an accurate picture of the COVID-19 situation in the country. In the last 24 hours, 4 more people have died and 105 more people have tested positive for COVID-19, as Dorcas Wangira reports.
With the majority of Kenyans defying safety protocols, including staging of massive political rallies where crowds mill, no social distancing observed, and no masks worn, it would seem that we are past the pandemic. But medical experts warn that nothing could be further from the truth.
There is a fear that our cases might actually be going up, and this may be attributed to the reduction in terms of adherence to the COVID-19 measures, and possibly the public have gotten into some sort of pandemic fatigue, and everyone is just tired of the COVID-19 measures, and that is the biggest risk. When you're not taking care, most likely you might see infections going up.
In the last 24 hours, 105 people have tested positive for COVID-19, bringing the cumulative cases to 104,306. The sample size was 3,573, yielding a test positivity rate of 2.9%. So far, Kenya has carried out 1,269,346 tests, barely 2% of the population in almost a year since the onset of the pandemic. 4 more people have died, bringing the cumulative deaths to 1,827. 333 people are admitted in hospitals, with 51 in ICU, 23 on ventilatory support, and 24 on supplemental oxygen. Medics urging for more testing. In the past 7 days, 1,334 positive cases and 28 deaths were recorded.
We haven't gotten to a level where we are doing mass testing. As it is right now, majority of the people being tested are either people needing to travel, either people who are sick, but we are not doing a lot of initiative to test mass, and which will give us a better epidemiological data as to how we are moving with the pandemic.
As Kenya awaits the arrival of the vaccine at the end of February and the administration of the jab beginning from March, the Ministry of Health is making plans to work with the private sector to complement government efforts. The ministry will allow some private pharmaceutical companies to import coronavirus vaccines, albeit with the government monitoring the prices and regulating the process.
So the government alone is not going to undertake this exercise. We've mapped out the facilities and actually recognize almost half the facilities are in the private and faith-based organization. So almost half of the vaccinating posts in the end, which will be almost 8,000 vaccination posts, almost half of them are run by faith-based and private sector.
The Ministry of Health, however, has repeatedly maintained that the vaccine will not be a silver bullet against COVID-19. While vaccines are meant to prevent hospitalization and severe disease leading to death, only the preventive measures such as hand washing, maintaining social distancing and wearing masks remain the best safeguard against COVID-19, with the need to go back to reinforcing public health measures, especially with flu incidents being high in Kenya during the wet months of March and April. Dorcas Wangira, Citizen TV, Nairobi.